Application of electrodes begins with a thorough cleansing of the electrode site directly over the coronoid notch in front of the ear. The assistant then cleanses the opposite side. Thorough cleansing of the electrode site will reduce the resistance and facilitate the transmission of the stimulus through the soft tissue in the coronoid notch area to the trigeminal and the facial nerves. These are the nerves that are going to supply all of the muscles of the facial and masticatory muscles. The assistant then lifts the hair to cleanse the back of the neck, because the common electrodes are going to be applied at the midline of the neck area, as you see here. The other site is determined when the doctor will palpate the trigger point of the trapezius muscle, which is right here, identified by being a very hard nodule or taut band. So the assistant then cleanses that area, and we then palpate the same trigger point on the contralateral side. The assistant will then apply the pre-gelled electrode so that the arrows are placed directly in front of the tragus of the ear and just slightly above, as demonstrated here. Then the contralateral electrode will be placed directly over the coronoid notch on the opposite side. The blue arrows are placed slightly above the pointed part of the tragus of the ear. The common electrode is then placed just under the hairline, and it's very important that it is oriented as close to midline as possible. There. This completes the application of the electrodes to stimulate the 5th and 7th nerve. The assistant then places the electrode directly over the area that has been identified as the trigger point. We now have 2 common electrodes and 2 active electrodes over each of the trigger points. If the patient has a unilateral trigger point and a trigger point is not identified on the opposite side, you place the electrode bilaterally so that it is symmetrical with the electrode on the trigger point side. The electrode leads are now applied bilaterally to the active electrodes over the coronoid notch. The red common lead is then applied to the uppermost of the common leads. The assistant then will apply the common lead to the midline of the lower electrode on the neck, followed by application over the right and left trapezius active leads in that manner. We are now ready to proceed with the application of the J5 to both of these sites. Now that we've applied the electrodes, it's time to turn the myomonitor on. But before you turn the myomonitor on, make sure first that the amplitude on both banks of controls is at 0. Also make sure that the balance control is in the straight upright position on both the left and the right controls. You can then turn the myometer on, and we begin to advance the amplitude on the right control bank, and we ask the patient to identify when they first feel the slightest sensation from the J5. And this sensation will be over the coronoid area. And tell us when you first feel a sensation. This is an amplitude of 2.5, which is a very common range of amplitude to find first perception. The first sensation was at an amplitude of 2.5. At 4, we are beginning to see stimulation and involuntary contraction at the corner of the mouth and the corner of the eyes. This is the 7th nerve being stimulated neurally by the stimulus of the J5. You observe the mandible. There is a very, very slight upward rise every 1.5 seconds that is an involuntary contraction of the masticatory muscles initiated by the J5. This amplitude is now at 5, which is called clinical threshold. Clinical threshold is that amplitude at which the mandible is involuntarily elevated with each stimulus. We then let the patient relax at that amplitude. Do not advance the amplitude at this time.